The way we deliver care has to change. The status quo, the way we have access to information, the way we receive information around our own care has to change. My work is really about improving care for people living in this province with a focus on quality, safety, and just really improving the overall care experience. The opportunity that we have with personal health records is for people to have access to their own information so they can be actively engaged in their own health. And I think our learning from the pandemic has shown us as well that the family is part of the care team. So when I think about the opportunity for a personal health record, it's not only for the patient to have an accurate understanding of what's going on in their care, but it also provides opportunities for family members who are part of the care team and patients to know and to be able to verify what providers have access to, what information they have access to, and whether that means they can provide corrections or they can say, you're missing some pieces and I want to add those in. But when you're a family member and you don't know what the care team knows about your loved one, it's a bit of a black hole. And I think that leads to poorer outcomes or missed opportunities around quality. So personal health records can be a game changer, I think, in the system going forward. The opportunity to go to Valemont as part of the design thinking process for the personal health record, for me personally, afforded an opportunity to understand the rural care experience in a way that I hadn't understood before. I was just so impressed by the dedication that they have in that community and the challenges that are faced in rural. The importance of focusing on rural as an opportunity to provide a foundation to do the work for the rest of the province is important, because if you design for where the greatest challenges are, it will work for anyone. So if we can get it right there, then I think we'll have the greatest opportunity for BC. And so the approach that's been taken to date, I think, really lays that foundation well, because there is that shared vision and shared purpose now in that community amongst the providers and the patients, and also a shared understanding of the lived experiences that we each have, that I don't think before this process happened that they had understood and appreciated. This is going to require a big shift in practice if we can actually ultimately get to a fully open record. It used to be those who were trained and had the expertise, and now we're saying the care team includes the patient, the care team includes the family members. And so we have to give everybody on the team the access to the same information in order to provide quality care. The PHR is core to that, and I don't see us achieving that without that in place. When we think about how do we create a sustainable healthcare system that is high quality, the PHR is core to that.